The Mount Sinai Health System's neurosurgery department is known globally for pioneering breakthroughs in treatment of brain and spine diseases, rooted in a supportive, team-oriented environment that encourages diverse viewpoints and collaboration. We strive to provide the most comprehensive, individualized care for each patient. We have 3 major brain tumor programs at Mount Sinai: the Malignant and Primary Brain Tumor Program, the Skull-Based Tumor Program, and the Pituitary and Neuroendocrine Program. During the past several years, we've seen tremendous growth in research around these programs and have recently received over $10 million in federal funding focused on malignant brain tumors. Our research studies mechanisms of brain tumor differentiation, tumor cell proliferation, and invasion. Most importantly, we're developing novel treatments for patients with brain tumors. The Icahn Laboratory received an NIH grant for $3.4 million to study the use of magnetic nanoparticle hyperthermia in combination with radiation and chemotherapy to target brain tumors. The Zoe and Friedel laboratories focus on how brain tumor cells originate and how they migrate and invade into normal brain. The Hamburg-Zumian laboratory studies the microenvironment of brain tumor macrophages, developing new ways to amplify their effects in fighting brain tumors. The Sankova laboratory studies mechanisms of glioma growth and migration, which is an essential feature making them so difficult to treat. Our team of brain tumor surgeons are among the best in the country. The group consists of Professor Isabel Germano, who was recently elected as chair of the section on brain tumors of the American Association of Neurological Surgeons and Congress of Neurological Surgeons. She is the first woman ever to be elected to this position and the first Mount Sinai physician ever to hold it. Professor Kostas Hadjipanias runs the Nanotechnology Laboratory and is one of our outstanding surgeons, bringing advanced digital and robotic technologies to tumor resections. Dr. Raymond Young is a Mayo-trained brain tumor surgeon who has a great experience and does a very high volume of brain tumors at Mount Sinai. Our skull-based surgery program is jointly managed with ENT. Together we perform an extremely high volume of endoscopic and transnasal procedures using advanced minimally invasive techniques for a large variety of pituitary and skull-based tumors. Our endocrine division and world-class neuroendocrinologists join in running the Pituitary and Neuroendocrine Center, where we treat one of the highest volumes of pituitary tumors in the city in the Northeast. I'm privileged to work with Drs. Kalman Post, Raj Srivastava, and otolaryngologists Satish Govindaraj, J. Mark Ilaretta, Anthony Del Signore, and others in the skull-based surgery program. One of Mount Sinai Neurosurgery's greatest strengths is our use of advanced digital technologies for simulation and planning, as well as in the operating room. Augmented reality, virtual reality, and heads-up display, 3-dimensional exoscopes and endoscopes, and our robotic surgery programs all lead the field. These rapidly evolving techniques play a significant role in making neurosurgery safer, faster, less invasive, and leading to improved outcomes for our patients. If you or someone you know or care for has a question about the management of any brain tumor, please contact our offices and we will get you, your family member, or patient to the best team at the right time for the best care.